So how do I reassure someone who needs heart surgery? Historically, there have been times when heart surgery was very high risk, but that's not the case anymore. In fact, the higher risk is to not have surgery if you need it. We've been very fortunate at this hospital to have a terrific operating room team, a terrific ICU team, terrific support staff. My nurse practitioners are excellent, and we've had superb outcomes. The hardest part is for you to heal from the surgery, and that just takes time. But once you heal and you're back to normal, patients live longer, patients feel better, their exercise capacity grows, and you get them back a normal life. 4 or 5 days later, they're back at home, walking around, eating and drinking, and that's the norm, and that's what I expect will happen to my patients. It's very rewarding to watch someone who's very sick then recover and get back not just to a normal life, but a prolonged life, and a prolonged life with a higher quality of life. If I could tell the whole world what's most important for their heart health, for the average United States citizen, is to get up and move. Have an exercise program where you're up and moving. The American Heart Association recommends that we exercise a minimum 5 days a week, 30 minutes a day of mild exercise. If we could just get everyone to do that, heart disease would drop dramatically in the United States. The grandmother test is actually a really easy test. You look at each patient and you treat them as if it was your loved one. You have patients that sometimes can pose a challenge to know what's the right thing to do for this patient. If you look at that patient and treat them as if they were your grandmother, then it usually becomes easy. And you can do the same thing for every patient. If it's the same age as my brother, the same age as my father, that's what I do. I look at them and I say, what's going to help this patient live the longest, feel the best, and have the best quality of life? That's what drives my overarching patient care decisions.